Hello everyone, and welcome to this month's ATTC Network iTraining highlighting the Hispanic and Latino ATTC. Today's webinar is being presented by Dr. Daris Orobich and Victor Flores, and I will tell you a little more about each of them later. Whoops, too far. Okay, during today's webinar, all participants will be muted. The audio will be streamed through your computer, so please make sure your computer speakers are turned on and up to hear today's presentation. First, I'm going to review a few housekeeping items with everyone. If you notice that your viewer does not fit your screen, you can expand it by clicking the expand button located in the top right corner indicated by the red arrow. And now you'll see that your viewer is expanded to fit your screen. Also, you can collapse the GoToWebinar toolbar on the right of your screen by clicking on the small red arrow just on the left of that toolbar. And then click it again if you want to expand the toolbar. Okay, for today's webinar, all participants will be muted as we move through the presentation. As we move through the presentation, if you have questions for our presenters, we ask that you use the chat box on that toolbar. Simply type your question in and hit send. We will pause for questions at an appropriate time during the presentation and then again at the conclusion. Okay, a recording of today's webinar along with the presentation slides will be made available at www.attcnetwork.org/iTrainings approximately a week from today. And you can find all the other recordings and presentation slides from our past iTrainings at that same URL. 1.5 NADAC continuing education credits are available to those who attend today's live event. Participants will receive an email from me, Cindy Christie, following today's webinar with instructions for obtaining NADAC CEUs. So please note that today's webinar is free for participants, and there will be a fee of $15 for those of you who wish to obtain the CEUs. So please watch for that email in the next few days with information containing how you get the certificate. Okay, today's webinar is sponsored by the ATTC Network. As of October 1st of last year, the network was restructured and it now consists of 10 regional ATTCs, 4 national focus area ATTs, along with the network coordinating office. As you can see by this map, the regions were realigned to better fit the current HHS regions. And you can see the 4 national focus areas listed on the left. And today's webinar is the second in a series of 4 that highlight each of the new national focus area ATTCs. The network is funded by the Substance Abuse and Mental Health Services Administration and serves a critical role in improving the health of our nation. The network achieves this by translating, disseminating, and promoting the adoption and implementation of evidence-based clinical practices and strives to improve the health and wellness of individuals whose lives have been impacted by the disease of addiction. You can learn more about us by visiting attcnetwork.org. And as I just mentioned, we're funded by SAMHSA. SAMHSA strives to reduce the impact of substance abuse and mental illness on America's communities and demonstrates that behavioral health is essential to health, prevention works, treatment is effective, and people recover from mental and substance use disorders. For more information on SAMHSA, please visit www.samhsa.gov. Okay, and now I'm going to tell you a little bit about our presenters today, and forgive my attempt at a Spanish accent. Daris Orobich is originally from San Juan, Puerto Rico. She obtained a PhD in clinical psychology from the Carlos Albizu University. She's worked as a research coordinator, participating in various studies aimed at developing screening instruments for Puerto Rican children. She's also worked at the Puerto Rican Rape Crisis Center as a therapist, educator, and service coordinator, serving the survivors of sexual abuse and educating professionals and the community. Currently, she is the Technical Assistance and Training Coordinator for the National Hispanic and Latino ATTC, along with her private practice. And Victor Flores is originally from Nogales, Sonora, Mexico. He has a master's degree in counseling with an undergraduate degree in sociology. His experience has allowed him to be in various positions within many systems, including courts, behavioral health, and other nonprofit organizations. He is presently the technical assistant and training consultant for the National Hispanic and Latino ATTC, and he also provides assessment, screening, and ongoing treatment to specialized populations. And now I'm going to turn the presentation over to Dr. Orobish, and I think we're going to run a couple of polls. So give me just a minute to turn over the controls. Okay, Doris, I think you should have a pop-up box asking you to accept the presentation and to, yeah, we can see it. Yes. Terrific, terrific. You can put it in the presentation mode.
Again?
That's it.
All right, can you see our screen here?
I do see your screen.
Okay, good.
It's still not in full presentation mode, and I think you just, now it is. It's great.
Is it now? Okay.
It is. You might want to collapse your toolbar also. We're seeing a little black spot. Do you want me to start one of the polls?
Yes, please.
Okay. We're going to get to know you just a little bit better, and this is very easy. Okay, do you currently serve Hispanic and Latino populations with substance use disorders? Obviously, just yes or no. Okay, we've got about half the votes in. I'm going to leave it open for about 3 more seconds. Okay, I'm closing it, and I think most of you can see the results. We have 74% yes, they are currently serving Hispanic and Latino populations, and obviously 26 say no. Okay, let me hide those results. Dr. Orobish, do you want me to continue with the rest of the polls? The
Yes.
first 3? Okay, got 3 more questions coming up, everyone. Okay. Are you planning to serve Hispanic and Latino populations with substance use disorders in the next 6 months? Well, it looks like a large majority are saying yes. I'm going to close the poll and share the results. We have 91% saying yes, they do plan to. Okay, the next question is, which field of work do you represent? A, substance abuse, B, mental health, C, primary care, D, education, and E, we do have other, and if you want to use the chat feature, feel free to type in some of the other areas you represent, and I'll see if I can name a few. There's some ATTC people on the call, obviously. Okay, I'm going to close this poll, see what we get. Okay, we have 43% of substance abuse, or I'm sorry, represent substance abuse, 23% in mental health, 6% primary care, 14% education, and 14% other. And some people on the call represent gambling, along with the other ones mentioned. Okay, and the last question for now is, what is your current professional role? Counselor or therapist, social worker, case manager, a nurse or physician, and student / faculty is the last. Okay, lots of votes coming in. I'll leave it open for a few seconds. Okay, I'm going to go ahead and close. And we have the majority, 57% are counselors or therapists, 14% are social workers, 7 as case managers, 4% nurse physicians, and 18% represent student and faculty. Okay, that was the last of our polls for now. So, Darish, you now can start.
Okay, thank you, Cindy. That's great. It's great to know a little bit about the audience. Thank you, everybody, for joining us today. We're going to be speaking a little bit about the National Hispanic and Latino Addiction Technology Transfer Center. This is, as Cindy mentioned, one of the new national focus centers. In the beginning of the presentation, we're going to be talking about Hispanics and Latinos, and I'm going to be giving you some statistics and sociodemographic information, okay, and then we'll continue from there. We're going to, midway through the presentation, we're going to have a few questions, and then Victor is going to continue, okay? So, let's start by defining Hispanic and Latino. Okay. Hispanic and Latino is a label that's used by the U.S. Census Bureau to categorize individuals of Cuban, Mexican, Puerto Rican, South or Central American, or other Spanish culture or origin, regardless of race. Okay? Hispanics and Latinos now comprise the largest minority group in the United States. In 2011, there were 52.5 million Hispanics in the United States, composing 16.7% of the total U.S. population. Also, between 2000 and 2010, the Hispanic population grew by 43% from 35.3 million. With a growth rate of 37.3, almost 3 times the rate of the total U.S. population. It accounted for half of the nation's population's growth over the same period. So we're seeing a huge growth and how significant this population is. The census projects that the Hispanic population within the U.S. will increase to over 132 million, which will be 30.2% of Americans by the year 2050. Yet this growth rate has not been paralleled by the development of information and services that effectively reach them. The Hispanic and Latino population is not a homogeneous population. In fact, it is comprised by about 23 different countries. It's a very diverse community, and it's dynamic and fluid, and it's dispersed throughout the United States. So when we address the needs of the Hispanic and Latino population, we see that a myriad of potential differences emerge, many of which are consistent with those of the population as a whole. Before we go into this slide, I'm going to give you a little bit more national statistics. We find that the median income for a Hispanic family is $37,759, whereas it is $49,455 for the total U.S. population. In 2010, the poverty rate was 26.6% versus 15.1% for the total U.S. population. We also find that Hispanics 5 years and older were much more likely to speak a language other than English at home compared to non-Hispanics. And also with regards to children, 61% of all Hispanic children live in low-income families, 8.8 million Hispanic children compared to 26% of white children. And what is important about this is that for these children and youth, there is a wide disparities in the access and outcomes of mental health services. Furthermore, children and youth of Hispanic descent are less likely to receive mental health services than any other group, and language barriers further exacerbate access problems for the population. Another issue that's really important is the fact that the Hispanic and Latino population is facing a public health crisis due to poor or unmet behavioral health needs. And access is hindered by the fact that 1 of every 3 Hispanics, which is 16 million, is health uninsured as compared to 11% of whites and 20% of African Americans. However, we find that the health reform is expected to provide an increased coverage of health insurance to at least 6 million Hispanics and Latinos. In fact, Hispanics and Latinos are positioned to experience the largest increase in insurance coverage, which will be about 18.2%, as compared to other ethnic groups and to the overall U.S. population. The National Survey on Drug Use and Health indicates that 9.7% of Hispanics 12 years and older reported substance dependence or abuse during the past year. So we find that there's an increase in the rates of drug use and abuse among the population. It is important to know that Hispanics and Latinos have been disproportionately impacted and are overrepresented in the national data on addiction. Several states and local health departments with large Hispanic and Latino populations are also concerned with these disparities and the lack of resources to address them. While some distinctive characteristics of the Hispanic culture, some of which are especially strong family ties, have been associated with the restraint from drug use among the population. It has been mentioned that these restraints are lower among non-immigrants, Hispanics, and Latinos, and those born in the U.S. Okay. So what does disparity mean? What is a health disparity specifically? The first attempt at an official definition for health disparities was developed in September 1999 in response to a White House initiative. The NIH, the National Institutes of Health, under the direction of the then director, Dr. Harold Varmus, convened an NIH-wide working group charged with developing a strategic plan for reducing health disparities. The group developed the first NIH definition of health disparities, which we find in the presentation. Health disparities are differences in the incidence, prevalence, mortality, and burden of diseases and other adverse health conditions that exist among specific population groups in the United States. Then in 2000, the United States Public Law, also known as the Minority Health and Health Disparities Research and Education Act, authorized the National Center for Minority Health and Health Disparities, and they provided a legal definition of health disparities. This definition is a population is a health disparity population if there is a significant disparity in the overall rate of disease incidence, prevalence, morbidity, mortality, or survival rates in the population as compared to the health status of the general population. So we find that this is an issue that has been going on for a while. People are noticing how services are not equal for all members of the U.S. population, and they're trying to do something about it. Studies show that Hispanic and Latinos seeking addiction and mental health treatment confront barriers to accessing culturally and linguistically competent care. Moreover, many of those accessing some level of care may leave treatment early because their needs are not adequately assessed or addressed. Also, some studies have found that low English proficiency or bilingual patients are evaluated differently when interviewed in English as opposed to Spanish, and that Hispanics and Latino are frequently undertreated. Hispanics and Latinos often report experiencing mistrust, discrimination, and linguistic and cultural barriers that may lead to miscommunication, misdiagnosis, and culturally irrelevant and insensitive treatment practices. The fact that there's a lack of a bilingual and bicultural workforce plays a significant role in disparities across all key areas of behavioral care services. We find that Hispanics and Latinos are underrepresented in professions related to behavioral health, such as medicine, nursing, psychology, and social work. Statistical data sustains this underrepresentation where Hispanic and Latino physicians comprise less than 3%, clinical psychologists 1%, social workers 4.3%, and registered nurses 1.7%. Unfortunately, these numbers may be lower as they don't take into consideration issues such as levels of cultural competency and if providers are bilingual. So we find that we have some professionals, however, this type of study does not, they may evaluate if the origin of the professional, but not necessarily if they are bilingual or if they, are trained in cultural competency. Also, Hispanics and Latinos frequently depend on service models and information that may have succeeded with non-Hispanic populations but do not necessarily meet the needs of Hispanics and Latinos. This mismatch between the population's needs and the service models available results in reduced access to and participation in drug treatment programs, low retention rates in programs, and absence of effective community strategies to help diminish cultural barriers and promote the use of culturally appropriate science-based treatment models in drug use service for the Hispanic and Latino populations. So one of the things that was created in order to work with disparities and the fact that few professionals are bicultural and bilingual is the CLAS Standards, the culturally and linguistically appropriate services in healthcare. These standards for culturally and linguistically appropriate services are proposed as a means to correct inequities that currently exist in the provision of health services, and also to make these services more responsive to individual needs of all patients and consumers. They are intended to be inclusive of all cultures, not just Hispanic culture, and not limited to any particular population group or set of groups. However, they are specially designed to address the needs of racial, ethnic, and linguistic population groups that experience unequal access to health services. Ultimately, the aim of the standards is to contribute to the elimination of racial and ethnic health disparities and to improve the health of all Americans. What is culturally competent care? Okay, cultural competence refers to being able to recognize and respond to health-related beliefs and cultural values, disease, incidence, and treatment efficacy. Examples of culturally competent care include striving to overcome cultural language and communication barriers, providing an environment in which patients from diverse cultural backgrounds feel comfortable discussing their cultural health beliefs and practices in the context of negotiating treatment options, using community workers as a check on the effectiveness of communication and care, encouraging patients to express their spiritual beliefs and cultural practices, and being familiar with and respectful of various traditional healing systems and beliefs, and where appropriate, integrating these approaches into treatment plans. What are the challenges that we face when working with the Hispanic and Latino population? Well, we find that there's insufficient epidemiological data, inadequate representation of Hispanics in treatment research, incomplete assessment, biases, assumptions, and stereotypes. And as we mentioned earlier, one of the things that happens is that people are being misdiagnosed. Okay, we find that they may go to their professional and maybe their symptoms are related to a cultural value, and then they're being misdiagnosed. Some of the issues related to treatment for Hispanic and Latino populations include immigration. With immigration, we find that it may lead to family dislocation, fragmentation, and reconstruction. The fact that you leave your family and you have to construct a new family environment in a new culture, which you find a culture change across generations, the language, family difficulties, customary behavior, cultural sensibility, and other barriers. So Cindy, I think now we're midway. We can do the rest of the questions.
Okay, let me get it started. Can you hear me?
Yes.
Okay. Okay. The question is, what type of setting do you currently work in? Substance abuse treatment, inpatient or outpatient, psychiatric facility, a primary care unit, managed care organization, or university? Okay, we've got about 50% of the votes in. I'm going to leave it open for a few more seconds. All right, I'm going to close this poll. And we have the majority of people, 55%, work in substance abuse treatment, inpatient or outpatient. Psychiatric facility, 3%. Primary care is 10%. Managed care, another 10%. And university setting is 21%. Okay, do you want me to continue?
Yes, could you do the rest of the questions?
Yes, I sure will.
Okay. Okay, thank you.
Okay, according to the Census Bureau, by the year 2050, the Hispanic population will represent which percentage of the total U.S. population? We have 16%, 30%, 50%, or 23%. I think I got that right. Okay, I'm going to go ahead and close this. And results are, no one said 16%, 30%, 63% said 30% of the population will be represented. 38% say half, and no one said 23%. Okay. Next, how many Hispanics and Latinos are expected to benefit from healthcare reform? Select one of the following: 10 million, 5 million, 16 million, and 20 million. Well, looks like with the votes coming in, we've got it split down the middle between two. I'm going to close the poll, and the results are 33% say 10 million, 39% say 16 million, 18% say 5 million, and the least, 9% say 20 million. Okay. And the last poll for today is, according to the national survey, what is the percentage of Hispanics 12 years or older with substance abuse? 9.7%, 6.5%, 8.3%, or 10%? We have a strong majority here. I'm going to leave it open for another 3 seconds. Okay. And the largest result, 9.7%, 65% of the folks said that's what it was. We have 15% for 6.5 and 15% for 10. And I think that gives you an idea. Okay?
Thank you, Cindy.
Sure.
I was also wondering if the audience, if anyone in the audience, have you been receiving any questions that maybe we can take now, or shall we continue and then take them at the end?
I just think one popped in. I'm going to read it verbatim. I haven't had a time to look at it yet. You mentioned that there is a lack of cultural sensitivity and competent workforce. What is the ATTC doing to help develop a better equipped workforce to work with this population?
Okay.
That's a great question.
Yes, it's a great question, and I think that you will find through the presentation that that's actually one of the goals of the National Hispanic and Latino ATTC, is to work with the workforce that is providing services for the Hispanic and Latino population in order to increase awareness and competence in issues related to culture. So also at the end, one of our team members, Jesus Diaz, is going to be showing you our website. Our website is filled with information on issues related to the Hispanic and Latino community and all the things that we're doing working towards that. So you'll find some products, and you'll find that we're going to be working with learning communities to train people in the different regions to work with providers of services on cultural, and on a product that is being revised right now. It's cultural elements. So we're going to be working with that also in order to achieve that goal.
Okay, thank you. I think there was a follow-up, but I think you answered that. It's about the resources, and I'm sure we'll go into that. I have one more right now. What is the ATTC doing to resolve the language barrier problem, I guess, if anything?
Okay, in terms of language, I think that's a little bit out of our scope.
Mm-hmm.
But I think that we can work with the people that already know the language, the Spanish language specifically. Some of the literature that we've been reviewing states that it's not actually needed to know the language, but to have the openness to learn about the culture is sometimes more important than actually knowing the language. Of course, if you have a patient that does not know English, then it's important that you work with that and that you can provide a Spanish-speaking person.
Thank you. Okay, I think that's all we have for now. Can you hear me?
Yes, I can hear you. So do we go with Victor?
Yeah, go ahead.
Okay.
Yeah, you can go ahead and continue with the presentation.
Okay, so it's Victor is going to be presenting now. Do you turn the screen to
Oh,
him?
okay. Yes.
Okay.
Let me take care of that.
Okay, can you hear me?
Hi, Victor. Yes, and you should have a little pop-up asking you to accept the presentation and show your screen. Yay! Perfect.
Am I on? And now I just go to this.
You are. You are on the exact same slide. Perfect.
Okay. With regard to the last question, if I may, since we're still on this slide, I'd like to say that with regard to language, on top of Dari's mentioned some things, but one thing that's really important to mention is that we're also focusing on being able to deliver trainings, even technical assistance, if we need to, in Spanish. So we're very prepared to do that, and we are considering almost every aspect. Not almost. We're considering every aspect we can to ensure that we're able to respond to the needs of each particular region. Hello?
Thanks, Victor.
Can you hear me?
Yep. Yep. Okay.
Okay.
You want to go ahead and continue with the presentation then?
I will, and just we'll be taking questions as we go, but for the most part, I want to start with, first and foremost, some of the things that we're doing in terms of being able to move in this direction. And part of the things that we focus on are what we call strength and recovery capital, things that most of the people that we serve, that they have, the strengths, the things that they bring to the table, faith, family ties, literacy, work ethic. There's some of the things that we can latch onto, and we're very cognizant of those in terms of going forward. So it's not like we come in as here's the experts and they just have the solution to everybody and to everything. We go in and we're in a learning modality as well as in a teaching modality when we can. So we want to make sure that we are very aware of ensuring that we take a strengths-based recovery approach. In terms of our priority areas, if you will, yes, we completely understand that not all the population, as Dottie said, it's a very diverse one, and yes, not all services is one size fits all approach. We understand the differences, not just in personality and the cultural and the values, different pieces that people bring to the table, but we also understand that you're in one area of the country is a lot different than another area, and we've been learning this as we go, and also we have a lot of good information coming in from each region, because each region represents a number of knowledge and experts that are coming and collaborating with us. In order to kind of get more clear on what a purpose, our purpose of our area in what we do is really we focus on workforce and definitely go into utilizing different and diverse different technology transfer strategies, services and practices, and really talk about some of those demonstrated results and see how we can move forward. We understand that in terms of promising practices and emerging practices, we have to take that into account, because sometimes we don't have all the data and we don't have all the information to say something is completely and 100% evidence-based. So it's really important to know that our population is one that is diverse. In terms of our focus area, we look at preparing service providers in terms of working with this population, and it's not okay to just say, well, somebody has a last name of so-and-so and we're just going to move forward with this, and understand that issues of assimilation, issues of acculturation are really crucial. The workforce that provides addiction treatment and recovery support for Hispanic and Latinos. I mean, I can't tell you how important it is to understand that the workforce consists of not just the professionals, but also the paraprofessionals, those people that come in on every level. So we got everybody that we work with, from the front office person all the way through the person that works with those folks that are in patient, that are very much involved in the social service realm. So again, we take that into consideration when delivering treatment, when delivering technical assistance, and also when receiving feedback. Those are really important aspects of how to move forward. What's really important is the goals of the project are congruent with the SAMHSA initiatives. And actually, Dottie's mentioned the use of cultural and linguistic information, such as the CLAS Standards. In moving forward, even though the CLAS Standards were authored in early 2000,
Hello. Doris, can you hear me?
Yes, I can hear
Seems
you.
like we're having a problem with Victor's
Okay.
microphone. Looks like we lost audio.
Okay.
And I apologize to everyone. Victor, I don't know if you can hear me, but do you want to unplug your microphone and try to plug it back in?
Let me see if
okay, I'm sorry, I had lost it there for a second.
There. Okay, I think everyone can hear you. Terrific.
Where did you lose me there? Because I just saw that.
Only, I think, one slide ago.
Oh, okay. Let me. I'm on the SAMHSA slide, so I'll just mention. Dottie's talked about the suite of services, and that included such things such as training, technical assistance, curriculum development, etc. We do everything and is inclusive of everything in order to be able to connect and collaborate with different regions. And we're talking about using information that's up to date, relevant, effective, culturally responsive, culturally competent. And I think that that's important when we're talking about being able to use and make sure that our project goals are congruent with SAMHSA's plan as well. As it goes with project goals, we want to make sure that we are focusing on evidence-based practices, and some of the ones that we don't have enough information with, make sure that we are moving towards this promising and emerging practices, because we know that as information comes in, a lot of these effective strategies that are out there are going to be more and more evidence-based as they're going to be proven. With regard to our goals, we want to make sure that we serve as a national subject matter expert and key resource for workforce that provides addictions and treatment and recovery support services. And basically, as I mentioned, maintain relevant, up-to-date information and resources to be used for the provision of training and technical assistance. We know how important that is. Our second goal is to ensure that Hispanic and Latino populations are seen as key and given priority among stakeholders and provided services through effective culturally and linguistic competence strategies and services. I can't tell you how important it is to make sure that we make the Hispanic and Latino a key priority. In the past, a lot of systems will make or entities with whom we interact will have sometimes not been able to make this a population that is as key as they would like. But now that you're seeing a lot of migration to different parts of the country where the emphasis needs to be in delivering services to some of these not often seen populations, now they're paying more attention to it, which we understand that completely. Goal number 3, broaden the ATTC scope on implementation practices, system transformation, focusing on Hispanic and Latino effective and cultural competent practices. I think it's just very important to ensure that we are, again, maintaining this focus, this relevance, and being informed, being responsive. System transformation consists of priorities, specializations, and again, to mention, one size doesn't fit all. There isn't a magic bullet, but rather there definitely is preparedness. Goal number 4, to develop and strengthen the skills and capabilities of the workforce that provides addictions treatment and recovery support services to Hispanics and Latinos through innovative technology transfer strategies so they overcome the health disparities that hinder their access to quality substance abuse disorders treatment. It's important that some of the regions with whom we work are doing things well, and it's important to grow those things, a strengths-based approach. In addition, some of them need some help in some areas where they could do things a little bit better, and that's when they come to the table and we're able to begin a dialogue of, let's see how we can strategize and make this the priority that it needs to be. So it definitely strengthen the skills and capabilities of the workforce. In terms of goal 5, to build a collaborative and communication relationship with other training, technical assistance centers, and technology transfer providers to improve services and avoid duplication of efforts. I can't tell you how important it is not to reinvent the wheel, and to also make sure that, there's some places around the nation that are doing a really good job around some things, and we learn from that because we are in a learning capacity, a learning modality, so we can take some things. In addition, sometimes we grow them, perfect them, modify them, and refine them. So we want to make sure that we are part of that, and in order to be part of that, it means that there's communication going back and forth, whether it's through webinars, whether it's through conferences, whether it's through any kind of information that can be shared using different technology, using face-to-face, you name it, just to make sure that that communication and that back and forth continue to exist. I keep on mentioning the different regions. Well, when you talk about addressing the different regional needs, you talk about collaboration with them. And collaboration doesn't just mean, hey, I know you exist, or it's a phone call and say hello. It's a lot more profound than that. And we're talking about a lot of these regions have their different personalities. The populations in each region differ from place to place. So you're talking about the needs of each, making sure that we're gathering the different data that's important, the geographic, the demographic, service data that allows us to kind of look at this in a more deep sense so that we know with whom we are working. And a lot of times the professionals and the paraprofessionals in each of the regions are able to provide us with a wealth of information that allows us to really look at it under a microscope and figure out some things. We want to ensure that by working in these regions in the different areas that we look at the information that's relevant, things that are priority, the areas, how they not just differ, but even within the regions themselves, there's diversity. There's rural, there's urban, there's race and ethnicity, you name it. Every demographic under the book is something that can be looked at each, and then how to strategize within that crucial and different regional information. You know, I keep on mentioning the partnerships and collaborations, and again, critical elements to reach the center's purpose. You know, we talk about the ATTC regional centers and how we interact with them and how the feedback goes back and forth. We put together anything, good examples are training of trainers where we bring members from each of the regions so that they can return to their particular areas and be able to be prepared to deliver some relevant information with regard to a specific topic. And that's really helpful. And sometimes we go and do teachbacks, you name it. So those kinds of collaborations and with the ATTC regional centers are what makes it an effective back and forth interaction. In addition, you know, we have an advisory board, and part of that advisory board is we bring together those people that are the decision makers, the shot callers, if you will, at the level of decisions that allow for things to either move forward or to be developed or grown. So that advisory board weighs in and is able to provide us some really good direction, some really good feedback, and things from which we know how to strategize and how to put together our manner of going forward. In addition, we convene, you know, and we have, and we are, if you will, a panel of experts, people we bring to the table. We want not just to be a subject matter expert, but we want to be able to operate from a place of people that operate from a research perspective, from a practice perspective, from the perspective of, here, I'm doing the work and I understand. So each one of us not only brings to the table a background, we bring to the table some of these things that are either proven and or something that might be in the works. So each one of us has different pieces that are just crucial. In our last, in order to really put together and to start us rolling the National Hispanic and Latino ATTC, what we ended up doing was convening a task force. And this task force that we convened in San Antonio really allowed us to see how we wanted to mobilize, strategize, and understand the things that were important as seen by this panel of experts. And once we convened our advisory board in Puerto Rico, we ensured that the people that came to the table, that were those decision makers, that were not just the experts, but those people that really understand that it's important to move forward in these priority areas. Once we convened that group, we took additional information and we were able to understand how to really put something together that was going to make sense for this key and priority population. You know, I keep on saying a lot about those regional centers, and it's so important to understand that, you know, even us coming in as a Hispanic and Latino ATTC, how we can be of help and how we can be helped, because we come in, and again, I will repeat this, we come in not as the know-it-alls. That's the last thing we want to do. We come in as a group of folks that is informed, and that we want to make sure that a lot of the things that we bring forward are helpful, and if they're not helpful, how can we make it so that we do collaborate in a very on the level and on the informed level, so that we're able to connect with the different regional centers. So in going forward, I think it's just crucial to understand that as a specialized center, we have that openness, and we are amenable to feedback, as well as knowing how to put together our collaborations, our connections, our linkages with those centers that will access our products, our assistance. You know, some of the things that we often look at is such things as how we partner. How are we really focusing on those competencies? How are we looking at those strategies? How do we know that we shouldn't move forward on something because we're either duplicating efforts or we're reinventing the wheel? How do we know that what we're doing is strengths-based? And how do we understand that how we're proposing to deliver services makes sense to a particular region? When working with we'll just say a rural place, for example, how do they utilize video teleconferencing and things like that? We consider those things, and that's really something that's important that in our partnership with each of the regional centers. I want to go ahead and before Jesus Diaz gives us a tour on our website, which we're definitely working on in order to make it user-friendly, I want to make sure that we're in a position to get questions answered before. So I'm not sure. I'd like to open it up to any kinds of questions at this time.
Thanks, Victor. Yeah, I have quite a few questions coming in. I'm going to start with this one. It says, are we trying to persuade and or groom Latinos to work in the human services field by offering scholarships and incentives to work in drug treatment? Or do you know anything about that? And this person also says that he finds it impossible to find a bilingual counselor or social worker, and he's in a heavily populated area as far as Hispanic and Latino population. He's in New York, Long Island.
I like the question. The two words used are persuade and groom. I would like to use the words attract and grow. And here's the thing. I think that what we are trying to do is make this field attractive and basically specialize it, but make it so that it's something that people want to move toward, especially this population that's in need. And unfortunately, with regard to Hispanic and Latino paraprofessionals and professionals that are coming into the field, which are not that many, other areas, not just social service, are competing for the same people because of the growth of this demographic. So there's a lot of competition. So we're in competition. So what are the kinds of things that we can do to make this attractive? So whether it may be an information booth, whether it may be a conference to focus on these youngsters, you name it, there's different things that can be used to make this very attractive.
Thanks, Victor. Okay, here's another one. Let me find it. Will there be, do you know of it, and if in the future, will there be a service that can assist agencies to review their competency plans and an assessment tool to be used in that agency?
I'm telling you, I like these questions. I think I like questions better than I like to present, but I'm going to tell you, I think this question is excellent. And one of the things, and I don't want to give away our information too much here, but I know that even in our own discussions, we've talked about screening tools to work on. And in my knowledge, there's different tools that are out there in order to screen, but specific screening tools that are specialized are something that different agencies have gone after and have tried to perfect. And I think that's definitely an area of focus that can be not just focused by us, but by a lot of places. And maybe that's a good collaboration place to start for some places.
Agree. Thanks, Victor. This is a little bit related. Well, with regard to regional needs, could you provide examples of needs that are seen in different regions across the whole United States?
Absolutely. Some of the things, and just to use a couple of examples, some of the things that we're looking at, we'll just say along the border, we got a lot of immigration kinds of issues, and what you're talking about is how to utilize some of these really things that are working on the border, for example. Some of those, the promotora models, for example. How do we grow that in behavioral health? And although it's already being used at certain levels, how do we grow that a little bit more to make them either more specialized or at least more user-friendly to some of the people that are already in behavioral health? How do you make it so more relevant? So there's a lot of areas of growth in that, and there's already some people doing work on this. So the positive thing is, how do we connect to some of that, and how do we make sure that what one area is doing is not copied or duplicated, I should say duplicated, in another. But that's just one example of a regional particular thing.
Thanks, Victor. I think we have time for one more, and I'm not sure if Doris would like to weigh in on this, but it's how are you developing evidence-based practices that are responsive to the needs of the Latino population?
You know what? I'll give it to Daris because I feel like a question hog right now. And I'd love to answer, but I want to give it to Daris because I just like to finish together.
I think I've unmuted her. I hope her microphone's on. You might be stuck with answering, Victor.
I might be stuck. Daris.
Yeah, I'm showing on her microphone icon a little slash mark that I can't move away. So.
Okay, I'll go ahead and answer.
Okay.
If you want, could you ask me again just to make sure?
Yes. How are you developing evidence-based practices that are responsive to the needs of the Latino population?
Well, we're making sure we're looking at different pieces of practices that are out there that are working. And what is working, we're seeing now how do we get additional information to see if something is working but there's not enough information. So we're actually taking into account those practices that are not yet evidence-based. We're taking the evidence-based ones, but we're also looking at the ones that are specific to Hispanic and Latinos that aren't quite enough information out there yet. So those ones that we refer to emerging and promising practices, we're looking at some of those to see how we either can grow it or how we can add to it. And some of the evidence-based practices that are out there, how do we adapt them to the population? Because there's a lot of great evidence-based practices that can be adapted and are adaptable. So we do that, and we look at some of those because different regions have things that are very effective in their areas. Hello? Cindy?
Whoops, maybe you didn't hear me. I am going to turn the presentation over to Daris and Jesus. We might have a technical issue. I'm seeing on my toolbar that their microphone may not be connected. So if you're hearing me, Daris, can you check your, yeah, now it's working.
Can you hear us?
Yep, I just saw the icon flash. Okay, I'm going to turn it back over to Daris and Jesus.
Hello, everyone. Thank you for being here with us. If you hear me talking and you see Dr. Orovich's name, that doesn't mean that her voice has changed. It means that it's my voice, the one you're listening, Jesus Diaz's voice, all right? So I'm part of the staff of the National Hispanic and Latino ATTC, and what you're seeing on your screen is our website. If you go into the www.attcnetwork.org and you look for the National Hispanic and Latino ATTC, you will find us there. And the screen that you're seeing here is the one that we are working right now. And what I'm about to do is just to give you a quick tour that will allow you to identify the places and links that you can find and access, so you can have some resources available to you so that you can improve your practice and improve the delivery of services that you provide to Hispanic and Latino populations. First of all, like I mentioned, this is our homepage, and at the top of the homepage you can see that we have a banner there and a few tabs. And this section right here at the top is the one that we typically use to make announcements and provide an overview of what's going on. You know, for example, we had an announcement for this webinar, and there you go, you have it there. Also, if you look at the banner, for example, it announces that there's an upcoming newsletter that will be available to you on April. Also, you have access to our calendar of events. If you clicked on the banner, you will see what's upcoming, and you will see the dates and the different things that will be happening and taking place. Now, if we go back to the home page, and you keep going and scroll down, you will have our purpose there, and you will have the opportunity to subscribe to our newsletter in order to keep yourself informed of what's going on. From time to time, very often, almost daily, the National Hispanic and Latino ATTC posts different things that might be of interest to you on our Facebook page, on our Twitter, Google Plots, etc. For example, I just recently posted an announcement for a conference related to substance abuse and a call of papers, where you can submit a paper and then present, as we professionals in this field do. If we go back, well, before we go back to the top, if you go to the bottom of the page that I'm showing right here, if you type in your email on that little field that says join our email list, then you will be able to subscribe to our newsletter, email list, and that will give you access to different the different messages that we will be sending that might be of interest to you. You just have to fill out a little form that will ask for your name, your email, job title, company, and your zip code, and then you click on subscribe, and there you go. You will be on our list. And we're constantly sending stuff out so you can stay connected with us and stay on track with everything that is going on with the National Hispanic and Latino ATTC. One of the links that might be of interest to you, it would be the products and resources. What would you find there? Well, if we click on products and resources, you will have the opportunity to download for free different products that we, the National Hispanic and Latino ATTC, has developed in time. And for example, if you are a professional delivering services to the Hispanic and Latino population, and you want to know more about the cultural elements that distinguish Hispanic and Latino populations, you have a product here that you can download and have access to it in order to improve your practice. And you will have a quick description of it, and it will tell you what this product is good for. And it will tell you the language that it is available, and you can download it and in a PDF format. So you will have access to this resource so you can improve and gain a little bit of more knowledge about the specific topic that the product is discussing. For example, the second one that we have here, family therapy and substance abuse in Hispanic adolescents. If you work directly with adolescents, hey, this is a perfect opportunity for you to improve your practice and access this product. We also have some products from the former Caribbean Basin and Hispanic Addiction Technology Transfer Center. If you click there, you will have a whole list of additional resources that will help you understand a little bit more about delivering service to Hispanic and Latinos. And here you have each product by topic. So you will be able to locate what you're looking for in terms of your needs, of your professional needs. Also, we have included articles, news, etc. And we're constantly updating this sort of database so you can have up-to-date material. Now let's go back to the home page, and so we can explore a little bit more what we have here. Now, if you want to know a little bit more about what we do here at the National Hispanic and Latino ATTC, I would like you to go to the key presentations, and there you will find different presentations that we have used to get us to know, to presentations that we have used for people to know us. For example, if you go under key presentation and you go to the network, you will have there an overview of what an overview that covers goals and initiatives of the National Hispanic and Latino ATTC. And if in order to see this presentation, you need Adobe Flash Player. In most cases, that's what you need when you go online and go to a website and want to see a movie, a video, etc. And this presentation provides this type of overview. Also, if you want to look at the how our network has been arranged, here you have an outline that illustrates how the national focus areas are distributed across the United States and the territory of Puerto Rico. That's fulfills the purpose of knowing a little bit more about the National Hispanic and Latino ATTC. Also, if you remember, Victor talked about the task force, that the advisory board and the panel of experts that help us and provides some input in what we do. And if you want to find out a little bit more about these folks, I will invite you to click on the advisory board, and there you could read up a little bit more about the people who is helping us out with this fabulous project. Also, you can see there another presentation that discusses the things that we're doing here at the National Hispanic and Latino ATTC. Another link that might be of interest to you is the external links. When we talk about external links, we're talking about different links or web pages that are out there that we feel will be of help and assistance to you in your practice. For example, if you want to advocate for the improvement of health services that Hispanic and Latino populations receive, well, you have a section here that relates to advocacy, and there you can find different links and pages that will assist you in the process of being an advocate for delivering services to Hispanic and Latino populations. And the list, like I mentioned before, with the products and resources, we're constantly updating this website. I mean, this section of the website with new stuff, so that you will be at the top in terms of delivering service to Hispanic and Latino populations. Like I mentioned before, we also include announcements of conferences, so you stay on the loop with what's new, what research is saying about delivering services, etc., etc. Another thing that I would like to talk about is, you'll know that social media, it's being something that it's big nowadays, and of course the National Hispanic and Latino ATTC is not going to stay behind. So we also have our Facebook page and our Twitter and our Google Plus account. So so you can also like us on Facebook and share our page on Twitter. So if you, for example, go to the section here that says stay connected, you will be able to, oh, I'm sorry, it's about us. You will be able to see the different links associated with the Facebook account, the Twitter, Google Plus, LinkedIn, YouTube, etc. And if you, for example, go to Facebook, you will be able to see our work, and make sure like I mentioned before, you will be able to see different things that I will be posting through Facebook and Twitter that might be of interest. And those things include calls for papers, research findings, events, and different things that will improve your practice as a service provider. If you want to find out more about our website, you may contact us here. Here's the email of our organization and our postal address, our main phone line, etc. And I think that's about it. Hope you like our web page, and stay tuned for new updates. And that's about it. I'll turn the mic to Cindy then.
Okay, thanks, Jesus. I'm going to leave that website up for just a second, and hello? I do want to.
Yes, we hear you.
Okay. I hear some background noise. I do want to reiterate that the PowerPoints on your website, especially the one about the strategic plan and the advisory board, have a lot of really good information about the future of this focus area. Since you've only been in existence for 6 months, and a lot of the questions I had coming in were about future plans and products. So I suggest that you take a look at those PowerPoints. I do still have Victor and Daris on the line, so I've got at least one more question, and I'm going to go ahead and ask it, although I think the answer deserves a whole nother webinar in itself, but I'm going to let you comment on this. Is there anything you want to say about the issue, the immigration and the issue of legality, and the fact that the Hispanic population does not, some of them don't have Social Security numbers and therefore insurance? Is there anything that ATTC is doing or going to do to bring this population forward?
I'm not sure if Dottie wants to take a whack at that, or me still be the hog, because I know not Dottie's is on right now. I see that.
You're doing a good job, Victor. So we can collaborate.
So Dottie, you want to try, and then I'll try, or what do you want to do? You tell me.
Well, what I want to mention is that as part of the meetings we've been having, this is one of the issues that's been coming up. How are we going to work with the immigration issue and the legality? Cindy mentioned, I think that yes, that could be a whole other webinar. But what I want to say is that yes, we're taking it into consideration because we understand that people who have been through the immigration process and people who may be in the U.S. illegally have to deal with some issues that contribute to their state of mind. So yes, that's something we're taking into consideration.
Can I add to that?
Yes, please.
Absolutely.
You know, and I think that brings a key point. Where she's talking about is she's talking about some of the people that are involved, that in the reason it's an immigration issue is because there's an emotional aspect to it. But I think that the question was more focused as well, was there was a focus on if they don't have a social security number, there's a legality question there, but that legality question actually turns into, are places going to be paid? For example, will they be able to draw down money to be able to assist some of these folks that need help because of some of those issues mentioned by Daris. And here's the thing. We understand that in some areas of the country where we'll say they don't qualify for services according to, because they don't have the number. We understand that, and that also some places have pots of money to be able to possibly help these individuals. But when we talk about the immigration issue, we see the implications not just emotionally but also economically, because a lot of these systems as it is are sometimes we have we're always talking about lack of funds or not enough funds for being able to deliver services. So we definitely, like Dari said, is something that we listen to and we consider. And then as far as the center, we also always talk about the quality of services that are being delivered, whether they're culturally responsive, linguistically responsive, etc. So we actually always look into every aspect of it, not just the emotional, but also the implications associated to being able to have the capacity, not just to train for workforce, but the capacity to be able to deliver services with a limited budget.
Victor, thank you very much. I think we're going to wrap up, but I just wanted you to know that I got a comment. This person would like you to know that your article in the ATTC Messenger is being presented to local administrators and politicians as a framework of efforts to improve services in our community. And they say, gracias for your good work. So I thought that was a nice way to end it.
Wow, that's a really
great.
great positive thing. Thank you.
Yes, and for those of you that aren't aware, the ATTC Messenger for March, available on the network website, features the national focus area, Hispanic and Latino populations. So I'm going to take back the screen and wind it up. Okay. At least I'm trying to. Okay. So I definitely want to take a moment to thank our presenters. They did an excellent job, and we do appreciate your time. I want to thank all the rest of you for joining us today. And just a reminder that a recording of today's webinar and the presentation slides will be posted and available at www.attcnetwork.org/itrainings. Excuse me. And last, this concludes the iTraining. I'd like to thank everyone again. Also invite you for April's iTraining, the third in the Get to Know one of our National Focus Area ATTCs. April will be focused on the National Frontier and Rural ATTC. And as you leave the webinar today, you'll be directed to complete a brief survey about your experience. Your feedback is very important to us, and we appreciate you taking the time to tell us what you thought of the webinar. Thanks, everyone. Take care.
Thank you.
you.